A report by the International Finance Corporation IFC, a private sector lending wing of the World Bank, indicates that Uganda's licensing procedures for investment in health services holds 81 requirements against 16 that are necessary, impacting on the sector as a result. A public-private partnership discourse in Entebbe today that brought along investors in health services and lawmakers also had the IFC praise for Uganda to quickly set up a national health insurance scheme.
Every country is trying to establish a social health insurance scheme, universal. The country that's leading in Africa right now is Rwanda, where up to 99% of the population is covered for a package of care that is essential.
With millions of dollars for private sector lending at its disposal, the IFC is expecting that reforms are equally needed to weed out the restrictive and weak legal and regulatory policies so as to support investments in the health sector.
Is child mortality improving? Is the level of the facilities improving? And often it's not. So we need to look at different ways of bringing more efficiencies and financing the health sector in the most productive way that's going to bring the services to the people.
But I believe that it can only work for very, very smaller percentage of the population. Those are the rich, the haves. But as far as the rural community, where the majority are, we need a social health insurance scheme for a start.
Well, I think the point here is how do we rearrange our system in terms of health provision, in terms of the available sources, in terms of the tested models.
The availability of drugs in the country is another thing that we should really look at as one very big advantage of having the PPPH in place.
According to this report by the IFC, households in Uganda constitute 49% of spenders on health services, followed by donors at 35% and government at 15%. Reina Urgent, NTV Business.